of what's going on a little bit. So there are local and systemic effects for this. The local effects, and it's usually lower levels of IL-1 and TNF-alpha, more adhesion, transmigration, endothelial cell retraction also, that's swelling. It's one of the major causes of swelling. So you have an immediate swelling due to histamine, and then a more longer-term swelling in an area is typically due to endothelial cell retraction, where the small proteins leak out and you lose the osmotic gradient. Systemic effects at high level, sleep, fatigue, fever, and you can actually go into shock at very high levels. So it can actually cause death if it's too high. And endotoxic shock is partly caused by that too. So that's when a gram-negative activates toll-like receptor 4 and generates too much IL-1 and TNF-alpha, and the person goes into endotoxic shock. All right, so drugs and natural products and foods that inhibit inflammation. So let's get to I shouldn't say the meat of the matter here. Mostly these are plants, but major drug classes. So go through some of the drugs that are used: anti-TNF-alpha drugs, anti-IL-1 drugs. So there's a new set of drugs coming out that block IL-1 also. Prostaglandin synthesis inhibitors, these are the well-known aspirin, ibuprofen, everything but Tylenol are anti-inflammatory. Tylenol acts pretty much just in the CNS. The leukotriene inhibitors, I'll get to this in a little bit. We'll look at the diagram and remind everybody, but prostaglandins and leukotrienes are your two major breakdown products, metabolites of arachidonic acid. When you use a prostaglandin synthesis inhibitor, you block one side and therefore you shunt. And most people will shunt then towards making more leukotrienes. Leukotriene inhibitors and leukotrienes do have some functions, especially in the lungs. So leukotriene inhibitors are used in asthma and other kind of cases. Glucocorticoids, these are the drugs that are called in when there's an out-of-control inflammation and can't be stopped, and it should be a drug of last resort at this point. It's got many, many side effects. It's very difficult to withdraw from. It has to be withdrawn from slowly. You can have rebound effects with it, but it's the big gun. It shuts down arachidonic acid metabolism. It shuts down CD4 helper T cells. It shuts down everything. You take enough of these, a person's going to be very susceptible to infections. And then there are some new drugs out that inhibit leukocyte migration. They have some of their own problems. They're kind of interesting, but they prevent leukocytes from getting to the site. One of them is a VCAM4 inhibitor. So there are lots of new drugs coming out in this area, and there's also lots of new information on botanicals. So we want to think about how to use the two of these together and then have some more information about what these new drugs are doing. Even some of the adverse effects for these new drugs aren't known. There is one new drug which inhibits the S1PR1 receptor, which is critical for getting activated T cells out of the lymph nodes, so the T cells don't leave the lymph nodes. It's used for MS. It's kind of interesting, and it does cause lymphadenopathy, and which you would expect because now the cells can't leave the lymph nodes, so it's got its own problems. It's kind of interesting what kind of drugs are being developed. It's all over every functional aspect of the immune system here. In the meantime, we have a lot of new research on natural products, and it turns out that they are acting all over the immune system also. So we have antioxidants, we have phytochemicals that stimulate NRF2, which I'll go into in a little bit. We have extensive data on inhibition of NF-kappa B, which is one of the key inflammatory molecules. It's a transcriptional activator. It turns on a set of genes that leads to inflammation. Inhibition of prostaglandins and leukotrienes, yes. A lot of botanicals actually do this secondarily by inhibiting COX, by inhibiting NF-kappa B that inhibits COX-2 in immune cells. Decreasing IL-1 and TNF-alpha secretion, again, a lot of times it's through this NF-kappa B pathway that botanicals are acting. It seems like a lot of botanicals target this key pathway. Alter T cell functions, we'll get to that coming up, which is shift or modulate immunity, or some substances that act at toll-like receptors, including probably mushroom extracts, which of course are fungal products. Some of the questions we want to ask about some of these products: what's their potency? What's their Ki?